Hi, today I'm going to be showing you the myofascial release for our rhomboids. So the rhomboids go from the inside edge of the shoulder blade to the spine, so just about this area. I'm going to be using my acumobility ball. If you don't have an acumobility ball at home, you can use a simple tennis ball. So we'll start with the ball up on the right side. You want to be on the inside edge of the shoulder blade. So if you put your hand behind your back, sometimes you can feel the edge of your shoulder blade pop out. So you want the ball to be in between the shoulder blade and the spine, getting into that rhomboid area. And then I'll guide you to move the ball down 2 times so we can work along the length of the rhomboid. So to set up for this, you will come onto your back, bring the ball on the right side, and then relax into it for a few breaths. If this is enough pressure, you can stay right here. Otherwise, you can reach your arm by your side and then lift your arm up towards the ceiling and across your chest. Hold there for a breath or 2. And then bring your arm back down by your side. We'll just take a few rounds of that movement, reaching your arm up and across your body. So the sensation that we're looking for is maybe some discomfort, maybe borderline pain. If it ever gets to be too much, know that you can always come out of it, or you can not do the movement, you can just hang out in stillness. So then go ahead and move the ball down about 1 inch or 2, still staying on the inside edge of the shoulder blade. Once again, just take a breath or 2 to settle in here. And then if you'd like to bring that movement in, once again, reaching your arm by your side, up towards the ceiling and across your chest. And you might find that as you move through this range of motion, you find some knots, some points of tension. Feel free to pause in stillness at any point and breathe into that tension, that tightness. One of the key factors with any myofascial release technique is your breath. So if at any point you feel like you're holding on to your breath, take a moment in stillness, come back to your breath, and use your breath to settle into this release. And one more time, go ahead and move the ball down. You can either reach back and move the ball down, or you can just lift your hips up and scoot your body back 1 inch or so. Take a few breaths in stillness. And then if you want, once again, coming into that movement. When you're ready, go ahead and remove the ball from the right side, and we'll move over to the left side. So once again, starting up pretty high, right along the inside edge of the shoulder blade. Take a breath or 2 to settle in. If that's enough pressure, stay there. Otherwise, reach your arm by your side, and then up and across your chest. Go ahead and move the ball down 1 inch or 2. Settle into stillness. Reconnect with the breath. Let your body just soften into the pressure of the ball. And then if you'd like, you can bring that movement into the arm. Remembering at any point that you can come out of this if it gets to be too much. But if you find when you're moving through your range of motion, you find some points of tenderness, feel free to pause there for a breath or two. And then last time, go ahead and move the ball down or scoot your body back. And then bring movement into that left arm. Sometimes closing your eyes can help relax you into the release. And then when you're ready, go ahead and remove the ball. A nice thoracic mobility stretch to do after doing that release is to hug knees into your chest and then roll totally over onto your right side. With the right side of your head on the ground. And then stretch your left arm out to the left. Let your gaze follow your left hand. And then pull the knees up through center, and then roll all the way over onto your left side. And then open your right arm out to the right. And pull your knees back up through center. And we'll end with a strengthening exercise for the rhomboids as well as a bunch of other muscles that surround the shoulder joint. So this is called shoulder protraction. You'll come into a tabletop pose. You want to keep your lower body and your core stable. So we're not moving the hips, we're not moving the low back at all. We're just moving the upper back. So as you exhale, push the space in between your shoulder blades up towards the ceiling. And then as you inhale, draw your shoulder blades towards one another as if you're squeezing something in between the shoulder blades. Exhale to push that space up. Inhale to pull your shoulder blades towards one another. You can continue this exercise for a few minutes or maybe just a few more rounds. If you want to step it up a notch, you can lift up into a full high plank, continuing with this shoulder protraction and retraction. While you continue with that, I'll just show you what it looks like up against the wall to give you a better viewpoint. So this is protraction, pushing the space in between the shoulder blades up. And then this is retraction, pulling the shoulder blades towards one another.